Hello and welcome back to my channel. I'm Erik Schabert. I am a doctor of osteopathic medicine with more than a decade's experience in family medicine and osteopathic manipulative medicine. And I have a great episode for you all today. Please remember that if you are finding this content helpful, to like, subscribe, comment, and share. If you do have questions, feel free to put those in the comment section. I do check back on these and I'll write back a response. And if required, I'll even make an additional video to answer the question. Thank you so much for tuning in. Today, I want to talk a little bit about high blood pressure, hypertension, and everything related to it. One of the important things I think we need to understand is that cardiovascular disease is the #1 cause of death in the United States. And I believe that the majority of those deaths are entirely preventable. Okay, so let's talk about one of the major causes of cardiovascular death, hypertension. Hypertension is extremely prevalent in the United States. Our latest estimates are that 48% of the adult population in the US, that's nearly 120 million people, suffer from hypertension. A number of those people are not even diagnosed. That is something that we need to change if we're going to prevent these kind of cardiovascular deaths. Let's get some basics out of the way so that we have an understanding of what we're talking about when we talk about blood pressure and hypertension. First off, blood pressure is measured in a two-number metric. There's what is commonly called a top number and a bottom number. So you'll hear numbers of, say, 120/80. In the medical community, we define that top number as systolic blood pressure and the bottom number as diastolic blood pressure. What this means is systolic blood pressure is the pressure in your vascular system as your heart contracts. Diastolic blood pressure is the pressure in your vascular system while your heart is relaxed. We used to think back in the day that at different times that one of these numbers was more important than the other with regards to cardiovascular risk. We now recognize that either one being elevated is equally bad, and we need to control both systolic and diastolic blood pressure if we're going to prevent heart attacks, strokes, and other nasty complications of elevated blood pressure. Okay, so now that we understand how blood pressure is measured, let's talk about what our goals for blood pressure are. First off, we define blood pressure as kind of being in three categories now as of 2023. And the first category is non-elevated blood pressure. And that is a top number of systolic blood pressure under 120 and a diastolic blood pressure, a bottom number, under 80. When the systolic blood pressure is between 120 and 139, we call that elevated blood pressure. We also call it elevated blood pressure if the diastolic number is between 80 and 89. Once the systolic gets to 140 or the diastolic gets to 90, we call that hypertension. Well, let's talk a little bit about how we determine what kind of interventions are necessary. With hypertension, that is the systolic of 140 or higher, or the diastolic of 90 or higher, we always indicate, or we always decide that we need to intervene with medications at that point. That is an indication for pharmaceutical intervention. No question about it. Always going to be recommended, because we know at that point, if we don't intervene in a way that gets that blood pressure down, that individual is going to progress towards what we call end organ damage. And end organ damage is defined as serious damage to any of the organs that can be affected by that process. In the case of hypertension, the primary things we're talking about are cerebrovascular disease, that is vascular progression to dementia and strokes, not things we want. We also talk about the heart. In addition to heart attacks, hypertension can also cause progression to atrial fibrillation and progression to heart failure. Again, things we really want to avoid. And we also, along with that, we can see end organ damage in the kidneys. Hypertension can cause progression to kidney failure and dialysis. Again, these are all outcomes that we desperately want to avoid. So medication interventions for hypertension are essential. And for elevated blood pressure, that is the systolic from 120 to 139, or the diastolic from 80 to 89, then we want to take some considerations and calculations. If somebody in the cardiovascular risk calculators that we have, and I'm not going to go into the details of that because it's a little bit beyond the scope of what I'm trying to get across here. But if you have that elevated blood pressure and you have at least a 10% 10-year risk of cardiovascular disease outcomes, then we're going to want to intervene with medications. And really what that's going to be determined by is a combination of, do you have known coronary vascular disease? Do you have reduced kidney function? Or do you have several other risk factors that are going to push up your cardiovascular risk? If you got those, then we're going to want to jump in with medicines even when you're just in that elevated category. Otherwise, we're looking at lifestyle modification to reduce blood pressure. The common things that can be done to reduce blood pressure from a lifestyle perspective are restricting sodium intake, elevating potassium intake through diet. That's eating a lot of leafy greens and eating certain fruits. Can elevate potassium in the diet, and that can lower blood pressure. Additionally, exercise is a potent blood pressure lower, and so is meditation. Each of those, though, only have effect for short periods of time. So you have to do it regularly if you're going to get your blood pressure down using exercise or meditation. The next thing I want to talk about is the importance of measuring your blood pressure at home. One of the best things you can do in order to make sure that you get the kind of outcome you want as far as blood pressure control is concerned is to be checking your blood pressures at home and keep a record of them. One of the things I ran into during my time in practice is that there's a lot of inertia, both on the patient end and on the doctor's end, not to act too aggressively with regards to blood pressure, particularly because we cannot diagnose hypertension on just one blood pressure reading. And if we're only getting snapshots of a patient's blood pressure when they come into the office, it becomes difficult sometimes to catch when someone is consistently running a blood pressure that needs to be treated. As a result, if you can take your blood pressures at home and we can kind of see an ongoing record to see if you're regularly bouncing up into that hypertensive range, that can let us know that we need to intervene with medications or adjust medications to try and get you to that target of 120s over 80s or below. By doing this, we can start to really prevent cardiovascular events that might otherwise occur. So if you can keep that record at home, it really helps your doctor out. So keep that in mind. Bringing that information in is always going to be welcome. And next, I would like to talk about some of the treatment options that are out there, because we have a lot of different medications. Most of them are pretty benign. So we can usually find a combination of medicines that will be able to control blood pressure without generating a lot in the way of side effects. Whether that's what we call water pills, diuretics, that increase the amount of sodium and fluid that you excrete to reduce blood pressure, or we're talking about things like beta blockers or calcium channel blockers that reduce the impact of the sympathetic nervous system and relax blood vessels, or we're talking about things like ACE inhibitors and angiotensin receptor blockers that act on the kidneys to reduce blood pressure. Don't be afraid of these medications. Your doctor will warn you of the potential side effects to look out for. And if you have some, there's usually another option to try and get that blood pressure down and get it to goal. My final take-home message is just how vitally important it is to treat the blood pressure sufficiently to get it down at least to 120s over 80s whenever possible. As we age, that may no longer be possible, and the thing we have to balance is not generating low blood pressures while we try and treat the high blood pressure. There is a condition called orthostatic hypotension. That means, and all that means is that when you are getting up from a seated position and standing, or when you are sitting up, when you've been laying down, that suddenly your blood pressure goes low. Because of it, you don't get enough blood flow to the brain, and you start to feel lightheaded and may even faint. We do have to be careful with causing that as we treat older patients aggressively to try and get their blood pressures down, because having blood pressure go low like that can cause falls, and those are killers as well. So we need to balance the need to treat blood pressure with the need to avoid those low blood pressure episodes. So we may treat to goals that are a little less strict in somebody who is, say, over age 70 or over age 80 than we do in younger patients. In any case, we do need to try and get blood pressures as low as possible without causing symptoms of low blood pressure and without interfering with exercise tolerance. So that really is my take-home message, is don't be afraid to check your blood pressures, and do not be afraid to get them treated, and get them treated aggressively with your primary care doctor if they are elevated. Thanks again for tuning in, and remember to like, share, and subscribe if you find this useful. And remember, the contents of this channel are really intended to give you information that you can use to interact with doctors in your area and get your health questions answered and your health conditions adequately treated. This channel does not constitute the practice of medicine. I'm not dispensing medical advice here, and there in no way does this channel infer a doctor-patient relationship of any kind. Thanks again, and I'll see you next time.